It's a very great day to be alive. Welcome to yet another episode of the TCG Couch podcast. Igama lami Ncamsile Buthelezi, and I'll be your host for the day. So I am the stage registered nurse, midwife, and psychiatric nurse. So today we're just having a very important dialogue, something that we overlook and something that is very, very important. We are talking everything breastfeeding. So I'm here with Dr. Newton. May you please introduce yourself to the audience?
Hello, audience, beloved audience. It's a pleasure to be here, and I'm truly humbled to be part of this podcast.
Yeah. So, Doc, maybe if you can just go through this year's theme of breastfeeding. It's one of the most important things that we need to unpack and then just go forth and talk about breastfeeding in general. So, Doc, maybe if you can just allow us to go over the theme for the year. It's a beautiful theme. I love it.
Amazing theme. It's themed breastfeeding, a sustainable start for life.
And then it goes, strengthen
what works.
So, yeah. Doc, breastfeeding remains one of the very most important thing, and I want you maybe to help us discuss the importance of breastfeeding, maybe touching base in immunity, how the child grows, how the brain develops, and long-term health benefits in that manner.
Yeah, so breastfeeding is a symbol of compassion, you know. Mm-hmm. It goes beyond the benefits of the baby. I'm sure you've invited other specialists who are going to talk about the benefits of breastfeeding throughout your life course. When we say things, it's a sustainable start in life, we really mean that your life changes just through the natural brain food that you start on breastfeeding on as early as when you are born. So, yes, I'm going to go into detail about the benefits of breastfeeding for the baby, but I would like the nation to know that when you see a breastfeeding woman, you know what, thank that woman, because literally that woman is giving us liquid gold. That woman is giving us a sustainable start in life. That woman is helping the country to grow into greater heights, to see a better vision, and taking Eswatini to greater heights just by breastfeeding your baby.
So let's breastfeed in public transport, please.
Absolutely. Let's have breastfeeding spaces in workspaces. Let's have breastfeeding in the bus rank. Mom, don't be ashamed of breastfeeding. You're helping the country in a very big way. You are growing a gem that is higher in intelligence, in many other ways. When you're breastfeeding your baby, you're creating a world that we only can dream of. So breastfeeding is power, my brother.
It truly is. I think I can even tell by the way you articulated that it is indeed power. So maybe if you can maybe touch depths in immunity, how is it really helpful to breastfeed in that essence?
So if you have your baby breastfeeding, literature says and scholars says that breastfeeding improves your immunity. The antibodies that you pass through your breast milk to your baby enable the baby to fight infection. So the risk of infection and illness is far lower in a baby that's breastfed than their peers. So it is not just nutrition, it's medicine that you're giving to your baby early on, and natural medicine that helps your baby fight diseases even better.
You make me wanna breastfeed my own children, but I unfortunately, biology cannot allow.
No, you cannot bring Ibele to the table.
I cannot.
Yeah.
So I think it also goes because you touch base on how it helps immunity. So it also help in growth in a way, because a healthy baby is a growing baby.
Absolutely. So beyond just nutrition, because I think the myth is that when you breastfeed, you're just breastfeeding for nutrition. Of course, nutrition is very important. Your baby is going to grow because you are giving nutrition. But breast milk is beyond nutrition, really. There's so many. That's why we term it liquid gold in the true sense of it, because it carries a lot of essential factors and nutrition factors and immunity factors. But importantly, from a neurodevelopmental point of view, it grows the brain. That thing is brain food, my brother. It's brain food. So if you want your baby cognitively more wired. If you want a higher IQ, we'll definitely tell you about breastfeeding. You know, in other countries where money is not even a consideration, they've considered having a breast milk bank. So that how important breast milk is. We bank it just the way you would transfuse blood. You give breast milk because it's liquid gold. It's nature's nutritious juice, you know, given to that developing brain. So you're fighting poverty through enabling a baby as early as they are born with the right nutrition, with the right brain developing and cognitive factors. So it is important that we do breastfeed. It is important that we do support a breastfeeding mother by all means. Work areas, please, by all means, maternity leave is not optional. It's not a favor. It replicates to economy as well in the country. If a breastfeed baby grows to be our CEO or something beyond that, you know very well you've given them a sustainable start in life.
Awesome. I don't even want to elaborate on what you just said. I think it was gold on its own. So I think as we maybe narrow it down and in closing, maybe if you can just like maybe go us through, like maybe just make us understand how you can tell that the baby is doing so well in the breastfeeding. Like maybe there's wet nappies and the likes. How do we tell? Oh no, the is breastfeeding well.
Yeah. So commonly, most mothers will come and say, "Oh, my baby's not full. My baby's always wanting to breastfeed." The other benefit of breastfeeding, you see how you hold your baby when you're breastfeeding. Mm-hmm. It's nurturing on its own. So it also produces hormones and psychological positive impacts to the baby, just the way you hold and handle the baby. And a breastfeeding mom will also produce the love hormone, which is called oxytocin. So just bringing the baby gives more than nutrition in the fact that you're going to hold and handle the baby in a love-enhancing way that enables the baby's psychological effects to be better. So they will want the breast because it's their safe space, okay? Awesome. Not beyond hunger. But the hunger cues is that baby will feed 20 minutes and they will latch out from your breast. And the way that we see that the baby is indeed feeding well is through weight gain. So we support them at day 1 to learn how to latch, to learn how to handle their baby, and then we monitor the number of wet nappies that they produce a day that will help us to see that they're well hydrated. And we're expecting about 6 to 8 wet nappies. Physiologically, they will tend to lose weight in their first week of life, but not beyond 10% of their birth weight. So when they come in at day 7 visit, we're checking if they're gaining weight and if their weight loss hasn't been excessive beyond the 10%. But if they're producing good enough urine, that's a good sign that they are breastfeeding well. And there's nothing wrong with feeding them as much as they want, and because that's when you bring them close. And that's the space they've known for the last 9 months. So helping them come close to your heart and smell that beautiful smell of breast milk enables an emotionally stable baby. So breastfeeding is beyond nutrition, you know.
Sustainable start in life.
Absolutely. Let's breastfeed.
Awesome, Doc. Maybe just like, maybe if you can just give us like 2-3 lines. When would you advise a parent to seek medical advice?
So we talk about danger signs early on. We teach them before they go home that if you see that the baby is not feeding very well, they're not keen on the breast milk smells good to the baby, all right? So if you have a baby that you put on your breast and they're not latching, that's a baby that we are concerned about. If the baby has been sleeping for a very long time, like 4-6 hours, and they haven't breastfed, it's a baby that would say, please do come and see your healthcare provider. And many others that include no urine output. If a baby's a nappy has been dry for beyond 6 hours, we're also very worried that maybe that baby is dehydrated and would recommend that you go and see your healthcare provider. But all in all, breastfeeding is power. Thank you for all the women that choose to breastfeed, because not only are you doing it for your baby, you also do it for yourself. There's many other maternal benefits that I think the other specialists will talk about. But beyond just mom and baby, there's economic benefits to breastfeeding that we also benefit from. So, yeah, that liquid gold, that woman that brings Iribele to the table,
is the one.
Please do thank them.
Thank you so much, Dogotela. That was very informative. But I think we cannot overlook the fact that Bafati and women in general tend to spend more time with midwives, and we need to get an insight in a midwife when it comes to such a very important discussion. I am joined by a seasoned midwife and a neonatal nurse specialist. And over to you. May you please introduce yourself to the audience and tell us who you are and
Thank you so much for the opportunity. I hope I get more of these in future.
I know, right?
My name is Lobe Sutfu. Some of you know me by Ncamsile and Kabulu. Yes, I'm a nurse midwife. And yes, currently pursuing my neonatal nursing, which is my passion. So, mother and baby, that's me all the way.
Yeah, most importantly, I think also that's going to help us and gain a clear understanding of breastfeeding in that essence. So, breastfeeding is usually called a liquid gold. Why is it called liquid gold? Because I mean, skin to skin, like and the likes. Maybe if you can go.
Just to add. Okay, maybe just to add on what Dr. Newton touched on. So when you say liquid gold, I think we know it gold danger.
Yeah.
Compound delaying. So when we say it's now liquid gold, you can imagine what this baby is getting from the mother's breasts. It's getting all the protective nutrients in the right quantities, the right amount, proper temperature. Everything is just there. You know, it's set.
Yeah,
all you have to do is just let your baby onto the nipple and we're good to go. Covers the baby for life, immunity. Go okay, just like the theme says, it's the start of everything good. So when you just say liquid gold, it's just liquid gold.
Like touches everything.
And I can not describe it better.
Okay, so maybe if ungasambisa through the latching process and also how do we position ourselves when breastfeeding, because and things like that. Maybe just like give us the proper positioning, latching and everything. An overview of breastfeeding.
Okay, so maybe before we move on to that,
okay,
I come in within that first hour of life.
Okay.
The golden minute, the first minute of life, transitioning to the first hour of life. So that's when we want to start latching and make sure the baby is good and set to go, right? So firstly and foremost, I'm there by the mother's bedside.
Right there.
To make sure they transition together. Because now the baby was in utero, next thing baby is out. Now and mother's panicking, still in pain, probably thinking that the first hour is maybe a bit too much. That is where we really need to initiate everything and start everything, get on base, get on point. So we need to latch the baby. There's a technique, so we want the baby to be positioned firstly in a proper way, supported by mostly half of your arm, the lower arm. We position the baby's head onto this joint. Please, Bumag, support the head onto this elbow joint and make sure that the baby's buttocks are now supported in the palm of your hand. So that now this plane of your arm is supporting the whole of the baby's back. Bring the baby to you. Turn the baby belly to belly. I think we remember that one. And then now with your other hand, you are supporting the breast with all 4 of these fingers beneath the breast, the thumb only above. The thumb is for what? Not for expressing and pumping and pushing and pulling, just to support the baby such that when they breastfeed, they don't suffocate. So it's getting the breast off the baby's nostrils. Okay. So now there's a technique. When the baby is latching, we don't want funny sounds, ne? We don't need weird sounds. It should be silent, but you can tell the baby is actually getting something. So we want a rounded mouth, all lips, bottom and top, around the nipple. That black part we call the areola. We try to see the baby latches onto that as much as they can. So most women feel like now the baby is suffocating, it's too deep into the mouth, which is what we actually want. We want it deep into the mouth and up by the upper palate, so that when the baby sucks, the milk just ejects into the throat and they swallow, so it's easier. So we want rounded lips around top and bottom, rounded cheeks, no sound, just a nice smooth transition, which takes time. It doesn't happen
Overnight,
overnight. So it's a skill and practice that needs us midwives to be there by the mother's side.
Well, I'm a midwife myself, but you just made me feel like I'm not a midwife, because that is the way to explain it. I think there's no better way to explain that. It is phenomenal. I don't even want to echo you. You did a marvelous job. But also, there's other issues that we often see. You find that the baby there's poor milk supply, and the baby is going hypoglycemic and the likes. What are the concerns around the first few hours of breastfeeding? Maybe let's go through that.
Okay.
Yeah.
So part of the role I mentioned is the supportive role, right? So I'm there guiding the mother, especially through the first hour, third hour of life. I'm there to make sure that this baby is trying or at least adapting on how to latch. And then now we have to do these intervals 3 hourly, just like Dr. Charity alluded. 3 hourly feeds. If the baby's asleep, we try to sensitize and stimulate the baby so that they continue and try to latch. Even before I attach that baby, I need to test and see if there is colostrum coming out of the baby mommy's nipples. What's colostrum now? It's this thick milk that comes first, ne? Some people don't consider it milk, but it's that thick, yellowish, creamy first milk that comes out of the nipples. So if I see that, I'm good to go. I know as I attach the baby more, then it will come and flow more throughout the day, especially the first 24 hours of life. So it's just a matter of reassuring. We attach, because what they usually say, what mothers usually say is, "Akafuni kumunya," and I'll be like, "Akafuni." It's like just been a few minutes, and then all of a sudden we're bombarding the baby.
You need to know something.
So I'm always like, no,
it.
It's like, rather, it's adapting. Just like you are adapting to being mother, just like your body's adapting to the baby's now out. So those challenges, we overcome day by day, step by step, supportively, until we establish a routine together.
Awesome. Maybe if you can just maybe give me a quick, maybe an outline or like a list of common breastfeeding challenges that you note, be it maternal or fetal.
On the baby's side.
Yeah.
Okay. Part of the challenges, like most of them, encircle around the latching. What is mostly the problem is we as women have different type of nipples. Some women have nice protruding nipples just for the baby. Is what's there to do for the baby is just to latch on it. It's nice, protruded, and then some of us have flat nipples, so the baby will be struggling to find the nipple. In that process, gets frustrated and starts crying, and then now the whole thing gets messed up. So usually it's just the nipple structure, maybe, and some of the babies get frustrated because when they suck, then the colostrum doesn't come as they wish it would once they establish the sucking reflex. So now they are frustrated. I'm sucking, but nothing's coming. So those are mostly the challenges. And then the one I've said, which the mothers will tend to give up easily. They feel like it's just magic, like boom, the milk will just flow in the first hour of life. Then they'll be like kind of like discouraged, and then they won't be willing to work together with us to say, no, it's a process, don't stress yourself, take it gradually, it's going to be okay. And we are also here by your side, but don't fuss,
to help,
because when you panic, baby panics now, then it's a just whole cascade of disaster.
Maybe I think, but you did maybe touch base on it, maybe just to make emphasis on it. What are the few things that babies things babies do that often worries parents in the first few hours of life?
Okay, recently, I'll just quote a patient I had. It was so funny because she was saying that he's always sucking. I think his baby's too full because the tummy is too small. And it was so weird because usually the women want it the other way around. They say, not feeding me, abo. So I think they usually worry about the little things. The more you deal with different individuals, you hear different concerns each and every day. But of course, most of them is the one that they won't latch. And then, is the baby getting enough feed? Is my baby okay? My baby seems hungry. Just around those parts, the hypoglycemia, they worry, good, my baby's not feeding. The blood sugars will be low. Will my baby be okay? So maybe those are mostly the concerns. Also, maybe they ask around, has the baby passed any stool in during delivery or anything, or passed any urine? They worry about those aspects usually during the first day of life.
Awesome. Maybe, as I'm not chasing you out of that couch, but maybe just the last question I want you to ask you: what could be that one word you think of beside liquid gold, obviously, that you think of when you think breastfeeding?
Breastfeeding, for me, it's life.
Life.
Life, health.
Thank you so much, Lobby. I think that was very insightful. I think it is very important that we also touch base with what midwives usually encounter as they talk to women and as they engage women in pregnancy. Really insightful. And indeed, breastfeeding is that liquid gold they're talking about. I'm joined by none other than Dr. Kabulu. He's one of the most phenomenal specialists when it comes to obs and gynes, and I'll let him introduce himself. I don't want to introduce you are. May you please introduce yourself to the audience and let us know who you are, and you're going to be part of the dialogue.
Yeah, I'm Dr. Kabulu Kadingi Arnold, but some they call me Sibusiso Ngambule, so it's still okay with me. I'm an obstetrician gynecologist working for the clinic group.
Awesome. Yeah. So, Dr. Kabulu, pregnancy, breastfeeding, it is very important that we prepare women for breastfeeding before they even actually deliver. Maybe if you can just maybe give us a journey, or like let's prepare this woman together during ANC, during pregnancy, and post-delivery, and the likes. How can we prepare these women for breastfeeding?
All right. Thank you for your interesting question. Breastfeeding is really important, especially for the child. But what we need to bear in mind is that during pregnancy, there are a lot of changes that are happening in pregnant woman's body. And these changes, they touch all the system, but because we are talking about breastfeeding, there are a lot of changes that are happening in the breast. Preparing the breast for the future role means production of the milk that the child will be getting. And we usually encourage patients during pregnancy to eat healthy. Why? Because nutrition is very crucial. Nutrition has a role during pregnancy, during labor, and even after. And there is even now studies that has proven that there is a lot of impact of nutrition during pregnancy, even on the offsprings. If someone is nourished, it can affect generation down the line. If you are over nourished, like the obese patient, that can affect the offspring even to the second, third generation down the line. So eating healthy is very important in various aspects of the growth of the baby, but because we are talking about nutrition through breastfeeding, it will prepare the mother to be for this breastfeeding process.
So one of the most crucial thing is the nutrition. But then how do we educate the women about that? What do we touch base on? Nutrition, and also what else can maybe we touch on maybe?
So before delivery or before childbirth, there is no much to be done beside the nutrition, the hygiene, yes, but the body does everything for itself. It's even smarter than doctors and nurses. The body is smarter. So it does all that preparation. The only thing that the pregnant woman shouldn't, it's to be aware of what is happening on the breast. They were probably small, now they are getting bigger. You will see some patients, they have even a very tiny, how do you call the nipple, but as pregnancy progresses, you will see
It's
it's also
protruding and-
protruding in preparation of what is going to come later. So yeah, that a pregnant woman should be aware of are the changes that are happening, and it's a lot of science, biochemical that are happening in the breast. She should be just aware of it.
Okay.
Yes.
So, encompassing breastfeeding also, but I just want us to touch base on the importance of ANC in general, not only for breastfeeding purposes, but just in the general importance of attending ANC classes.
So ANC, generally speaking, it's very important. Why? Because it's opportunity that is given to the healthcare provider to pick up any risk factor and attend to it as such for better outcome. Means a healthy mother, a healthy baby after the process. That's basically why we do ANC. But why is it important to attend classes? There are a lot of questions that a couple, generally speaking, because most of our patients, they come as couple. So in the consulting room, we don't have, with all the line number of patients we are having, we don't have a lot of time to explain into details things. But during antenatal classes, Magic Maternity, as we organize it at the group clinic, we have time, because every Saturday from 10 to 12, we have 2 hours. We invite all the couple. That's where we talk about everything, means the importance of ANC, means antenatal care, the changes that are going to happen in the body of the mother, especially for those who are conceiving for the first time. Attending antenatal classes, it's a time that we consecrate to explain into detail what is happening, ANC, the importance of it, and also why do we do. This is an example. Why do we do this investigation, for instance? This blood, why do we check the blood group? Why do we check the HIV status? Why do we look for syphilis and all those STIs, for instance? Why do we do the ultrasound in first trimester, ultrasound in second trimester, ultrasound in third trimester? All that we explain to the couple. That is during pregnancy. But we need also to explain to them what's the process of labor itself. Especially for those who are delivering for the first time, they've never been through this process. Then we explain to them what's labor, how are you going to pick up early sign of labor, when they come, the whole process in J till they deliver. Awesome. That's it. But we also talk to them about then baby once the baby is out, is because from the get-go we are talking about breastfeeding. We also explain to them, how do you breastfeed? Because it's okay talking about breastfeeding. Some they've never breastfed before. It's their first time. How do you do that? Yeah. And when I say how do you do it, we are really practical about it. How do you hold the breast itself? How often should you do this? And so on and so forth. We go into detail. Why? Because indeed during those classes we have time. Awesome. And then the danger signs as well. We need to make them aware about danger signs that can make them come to the hospital, even if it's not yet the time of their appointment.
You couldn't have said it better, Dela. I think you touched every detail. But from your own expertise and the time you spent with women, what are the common misconceptions or other fears that you actually encounter with women, especially those who are who gonna be delivering for the first time, which we call primigravidas?
Okay, most of the time it depends. It depends on patient we have, but most of the time there are quite a lot of misconception. The first one is that because I'm delivering for the first time, should I just go for a C-section straight away? They are scared of pain. This pain is is a natural process. Indeed, in some circumstances, it's possible to deal with the pain, but we have the whole team to support these ladies when they come to deliver for the first time, because what they are mostly scared of is the pain. But we usually even allow their partner to be there to continue their tender loving care, tell them how to push, and we explain. We are with them actually, and even when we tell them to push, we push with them. For those who have been with us, they know when we say fusha umgamlomutse, we also push with the patient. So we really accompany our patient through the process. About nutrition, there is this myth that if you are pregnant, you eat for two. No. You don't eat for two. You need to eat healthy, balanced diet. That is what is more important. Not eating the whole cow, saying, no, because now I'm pregnant, Mnumzane should bring the whole in-glove to me, no.
Yeah, okay. So I think that is very important. Guys, we are not eating for two. We are rather eating a healthy diet to counter for two. So what is the one question that you mostly asked in your consultation about breastfeeding mostly?
Okay. When do I start the breastfeeding? And for how long should I breastfeed? And while I'm breastfeeding, can I also use some other food, introduce some other food during that period of breastfeeding? So the answer is as soon as possible. When the baby is out, the mother can already put the baby on the breast. And we should understand that indeed you might not have milk flowing very same day. No, it will be a little bit, and the first milk, it's a little bit yellowish.
Colostrum.
We call it colostrum. It's full of components that are critical for the baby. There are antibodies that will protect the baby. There are a lot of nutrition coming from that. As soon as the baby is out, actually what we do is baby comes out. Before even we cut the cord, we put the baby on the mother for that skin contact. And if they are willing, they can already put the baby on the breast. And to stimulate the milk to continue flowing, that sucking of the baby actually stimulate the production of the milk and stimulate the ejection, means the ejection of milk. I think you understand what I mean. So as soon as possible. How long? 6 months, 6 first month, it's exclusively breast milk. In that milk, there is everything that the child needs. Water, anything is in there. So only after 6 months, that's when we can start introducing this other component of nutrition for the baby. But as for the first 6 months, they need to be exclusively breastfeeding. Yes. And when you give birth through C-section, is it going to delay the incoming milk? Yes or not? The answer is no. Whether you have delivered normal delivery or through C-section, there is no difference. The most important thing, as I said again, put your baby on the breast. They start sucking most of the time in the next 48 hours, means the next 2 days, milk will flow. And in case it doesn't, we have solution for that. There are medication that we can prescribe to even stimulate further that milk to come out. So, yeah.
There is no excuse for not breastfeeding.
No excuse for not breastfeeding.
Okay, so I think that was well said, Dr. Kabulu. I think we really appreciate that. So this year, when we look into breastfeeding, the theme for the year is breastfeeding for a sustainable start in life. So, and then strengthen what works. So what comment do you have in that? Because we say we want to sustain the start in life.
Nutrition in general is crucial for the development of the baby. Neurodevelopment means the brain, what is inside the inhloko. To develop, you need proper nutrition. And Nkulunkulu wasezulwini made things nicely such that breast milk is a balanced diet for the first 6 months. So they should breastfeed everything that child need for its development, for the whole system, for the first 1,000 days. It's in the milk, indeed, for the first 6 months, but even further, they will continue breastfeed. They will introduce some other component of nutrition, but we need to understand that nutrition is key on the development of the child.
Thank you so much, Dr. Kabulu, for the expertise, and we really appreciate that. I think I learned a thing or two. I'm a midwife myself, but I feel like this was just a refresher situation. And to viewers at home, we really appreciate your patience and just like staying throughout the entire podcast. And this was really indeed informative, and the whole idea is just to pass on the message at home, and also just emphasizing the importance of breastfeeding. Breast milk is indeed the gold that you need to give to your baby. The benefits have been alluded on, be it the nutrition, neurodevelopment of the baby, the immunity that is a boost to the child, and also just create that bond between you and the child. And indeed, we also still emphasize on exclusive breastfeeding, which aids in prevention of mother-to-child transmission, because anything can happen. You can say that I'm HIV negative today, but you don't know during that small period what can happen. You can there could be so many changes, so we need to protect our future. So breastfeeding is the right way to go. Thank you so much for being part of this, and we hope to catch you on the next one.